Hello, my name is Dr. Zain and I'm working as a physician in Islamabad International Hospital and Research Center. Today we are discussing about a very important topic, dengue. It is important to understand dengue, its causes and symptoms and prevention. Dengue is a mosquito-borne viral infection that has become a significant public health concern worldwide, particularly in tropical and subtropical regions. Pakistan is affected as well. In this video, we will do a comprehensive overview of dengue, its causes, symptoms, and preventive measures. So, what is dengue? Dengue is caused by a virus called dengue virus, and that belongs to Flavivirus genus. There are four distinct but closely related serotypes of the virus: DENV1, DENV2, DENV3, and DENV4. Infection with one serotype provides lifelong immunity to that particular serotype, but not to others. This means a person can potentially be infected with dengue up to 4 times. Now, how this dengue is transmitted? The primary vector of the dengue is Aedes mosquito, and these mosquitoes are typically active during the day, especially during early morning and before dusk. Dengue is transmitted to humans through the bite of an infected female mosquito. Once infected, the mosquito remains infected for life, transmitting the virus to others during subsequent bites. So, how would a patient of dengue or for someone who is infected with dengue present? The symptoms of dengue can range from mild to severe and typically appear 4 to 10 days after a person is bitten by an infected mosquito. Disease presents in three forms. Number one, dengue fever, and it's basically a very high fever, sudden onset of high fever, and it will reach up to 104 Fahrenheit or 40 degrees centigrade. Patient may complain of severe headache and also intense pain behind the eyes. There can be a muscle and joint pain. Sometimes it is referred to as a break bone fever due to the severity of the pain. Patient can also complain of nausea and vomiting. There may be a skin rash which may appear 2 to 5 days after the onset of fever. And there is a patient may complain of general weakness and fatigue. The other way dengue can present is dengue hemorrhagic fever, where there is bleeding. And this bleeding is because low platelet counts. As you know, that dengue affects the platelets. So the bleeding from the gums, bleeding from the nose, or bleeding under the skin, which can cause purplish bruises. So why it happens? Because dengue can affect the platelet count and can cause severe reduction in the platelet count, leading to these bleeding complications. Also, because of the same reason, the blood plasma can leak, and it can lead to shock if not treated. Shock means there is a low blood pressure. And that brings us to the third presentation of the dengue disease, which is dengue shock syndrome. And that is the severe form of dengue fever. It is a rapid and a severe decrease in blood pressure and leads to shock and organ failure. This needs to be treated properly, and if not treated properly, it can result in death of the patient. Now, how do we diagnose dengue? The diagnosis is number one, a clinical examination that we consider the symptoms and the patient history, and also do the lab tests. The lab tests are basically to detect either the dengue virus, which is dengue NS1, or the dengue antibody, and also checking the blood cell count, especially the platelets. How if we treat the dengue. As I said earlier, the dengue is caused by the virus, which is spread by the mosquito, but we do not have any specific antiviral treatment for dengue. So the management focus on relieving symptoms and the supportive care. Number one, hydration. So we can ask the patient or who's someone suffering from dengue to increase their oral hydration or take oral rehydration solution. If they are too much dehydrated, we need to give them intravenous fluids, i.e. through the vein. Number two is the pain relief because they may complain of severe pain. So the paracetamol or acetaminophen, chemical name for paracetamol, is given for fever or pain. We should always avoid aspirin and should always avoid an non-steroidal anti-inflammatory drugs like brufen, which can increase the bleeding risk. And it's also important that we monitor these patients, regular monitor of the blood pressure, regular monitoring of the platelet count, and also look for signs of severe disease. And if the patient has very severe dengue problem, then they need to be required to be hospitalized for intensive care and management of complications such as bleeding and shock. Now we realize that dengue can cause death, so and it is something a disease which can affect the community. So there must be something to be done for the prevention of dengue. So the prevention of dengue involves reducing the mosquito exposure and the controlling the mosquito population. So first of all, avoid mosquito bite. And how we do that? By using the insect repellents, wear protective clothing, long sleeves and pants to cover the skin, and use the mosquito nets, especially in areas with high mosquito activity. We should also control the mosquito population by eliminating the breeding sites. Remove the standing water from containers, gutters, and old tires. Cover the water storage areas. Ensure the containers are tightly covered to prevent mosquito breeding. Use the larvicides to be applied to the water bodies to kill these larvae. And also do community efforts like doing public health campaigns, education and awareness about dengue prevention like I'm doing today. And do regular inspection by community cleanup activity to reduce the mosquito habitat. It's very important to understand that dengue is endemic in over 100 countries, with approximately 3.9 billion people at risk of infection. The disease poses significant economic and health burdens, particularly in Asia, the Americas, and Africa. The efforts to control dengue focus on public health measures, vector control, and research into effective treatment and vaccine. So the take-home message for dengue would be that by understanding the cause, symptoms, and prevention methods for dengue, individuals and communities can better protect themselves and help reduce the spread of this potentially serious disease. Thanks for watching. If you found this video helpful, please share with your loved ones. And if you have any questions or topics you would like us to cover, leave a comment below. Stay healthy and see you next time.